Hello and welcome to this COVID-19 update. It's Friday the 29th of January 2021 and joining us is the Minister of Health, the Honorable Dr. Frank Anthony. Minister, thank you very much for joining us today.
Novax has been working on a vaccine, and that vaccine uses a subcomponent of the virus. And they have been working on this, completed phase 1, phase 2, and now they have some phase 3 results. They have done the clinical trials, as you said, in the UK with about 15,500 people. And they also had a trial in South Africa with about 4,400 persons. And they had some other countries that they've been working on. In the UK, the trials there have shown that the vaccine has been about 90% efficacious, which is good news. But the trial in South Africa has shown that you're getting about 50% efficacy, which is not so good news. And apparently because of the variants that is circulating in South Africa, the B1351 variant, there are lots of mutations on the spike protein, which perhaps is affecting the efficacy of the vaccine. So I suppose they would have to do some more work in terms of making the determination whether the mutations that have occurred with the virus, whether this vaccine is actually going to be very effective against it. Because I think how the vaccine was designed, the protein particle that they were using was mostly from the spike protein of the virus, and if that has mutated, then there is that possibility that it would affect how the vaccine works. Well, it's still early to say because all the vaccines that have been out for a couple months now, both the Pfizer vaccine, the Moderna vaccine, and of course now we have the Novax. All of these vaccines would have to undergo scrutiny again as it relates to the new variants that we're discovering. And right now, most of these companies and the scientific community are running additional trials to see how these vaccines hold up against the new variants. And you would know that there's a variant, the most recent variants that we're talking about is the B117, which started out in the UK but now is found in more than 60 countries. We have a variant that was found in South Africa, that is the B1351 variant, which has a number of mutations on the spike protein. And of course we have a variant, the P1 and P2 variants in Brazil. So all of these new variants have shown a lot of changes, mutations with the virus, and some of it might be of biological significance because they would affect the transmissibility of the virus, how fast the virus can transmit from one person to another, and also in some cases they're still working out whether the virus would increase severity, meaning more people would die from the virus. So there are still a number of characteristics of these new mutations that we don't know about, and it's being studied right now because, as you would know, some of these variants have only been discovered over the last 4 to 5 weeks. So it's kind of new in many ways, and so a lot of scientific work would have to go into it.
Okay. Minister Anthony, switching over to international travels, we would have learned that Guyana has suspended travels to and from Brazil. Can you confirm whether this is true and enlighten us what may have spurred that decision and for how long the suspension will be in effect?
So again, I don't think this is unexpected because we have said before that we were concerned about the variants that are circulating in Brazil and closer to the borders with Guyana. And that concern was there. We started by tightening up our land border. And both on the Brazilian side and our side, we have increased the measures to stem people going across the border. We have been officially opening the checkpoint on Thursdays to allow goods and services to be exchanged, but of course under strict COVID guidelines. So that is going to continue, where we are going to allow on Thursdays that exchange of goods and services. But we are going to tighten up the regime in how we are doing that. And we want to increase patrols along the border to deter people from crossing illegally from one country to the other. As we tighten up the land border, we also want to make sure that for now, that we restrict flights coming from Brazil to Guyana and vice versa. So all flights are now restricted. And again, because we want to know more about those variants before we can make other pronouncements. We're not the first country to restricted these flights. There are other countries who have done so. And again, it's out of concern for the variants that are circulating.
Okay. And in relation to the time frame, that will depend on how much
we would evaluate, and based on those evaluations, then we'll make those decisions as to when to reopen back the flights.
Okay. Some questions from the Guyana Chronicle. If you can provide another update on the samples sent to CARPA for testing, and if there are any details that you can provide as it relates.
At this point, no, because we have sent those samples to CARPA, and it would take at least 2 weeks for CARPA to process the samples. And when we get back the results, we would let the public know. But at this point in time, we have no additional information.
A question from HGP Nightly News. In light of the new strains of the virus, the government is being accused of having lax approach in combating same with respect to the closure of its borders. Just seeking a response to that.
Well, I think it's clear. We have already taken a decision pertaining to what we'll do with the border between Guyana and Brazil. And so, one, we have tightened up the border control to restrict movements of people going to Brazil and coming back over to Guyana. So that has been done. And now we have suspended flights to Brazil. I'm not sure whether they have any other suggestions, but we would be willing to hear if they have any other suggestion. But these are the measures that we have taken so far, and we'll have to see how those work.
And it's a final question. We're ending the first month of the year of 2021, and in 1 minute, if you were to, as Health Minister, put it in a nutshell as to how the first month has been for your ministry and combating the pandemic, what would you say?
Well, we warned people during December that in January we are going to see a spike if they don't take precautions in December. Unfortunately, a lot of people did not heed our call, and we are seeing a spike in cases. So, coming closer to the end of December, we had probably about 350 active cases. Now we are up to 816 cases. So you would have seen that increase over a very short period of time. And again, because people weren't abiding by these guidelines that we have established, I hope that people pay attention to what is happening, because we can only fight this virus if we're all fighting together. and each one of us would need to take on responsibilities. It is not a fight that the Ministry of Health alone can conduct, or one set of people and other people just do as they please. This is everybody got to be involved, and when everybody do the right thing, then we are all protected. But if some people choose to do the wrong things and don't abide by the guidelines, don't wear masks and so forth, then they're endangering themselves, their families, and of course the general public. So our appeal is to ensure that people do the right thing, and we are working right now to, to curtail spikes when we see them. But we need the assistance of the public, and the public can help us by doing the right thing, wearing masks, sanitizing their hands, keeping their distance, and so forth. We have spoken about these preventative measures repeatedly, but we just don't want people to hear them and know them. We want people to practice what we've been saying, because this would actually save a lot of people's life. So I hope that we can get that message across. Apart from the new cases that we are seeing, we also have an increase in hospitalization. And as we speak today, we have 19 people in the Ocean View facility, and we have another 2 persons at the Upper Demerara Hospital, the Linden Hospital. So we are seeing cases of hospitalization go up as well. So again, people need to be cautious, and you would have seen during the month we've had a number of deaths as well. So I cannot overemphasize how important it is to abide by the guidelines.
All right. Minister Anthony, thank you very much for joining us again. We wish you a good rest of the day and the weekend. And to your viewers, thank you very much for joining us. You can continue to receive updates and log on to our website at dpi.gov.gy and all our social media platforms. I'm Gabriela Patram. Goodbye.